Hello, everyone. Thank you for joining today's webinar, A University Community Collaborative Approach to Drug Testing. Just to begin, if you could please turn to the next slide. Thank you. I would just like to first begin by acknowledging that today's webinar is being broadcasted from the unceded traditional and ancestral territory of the Lekwungen peoples, now known as the Songhees and Esquimalt nations. Next slide, please. So first, my name is Rebecca Erickson. I am a policy analyst at the Canadian Mental Health Association's BC division, and I'm joined today by my colleague, Tanis Oldenberger.
Yeah. Hi, everybody. My name is Tanis. I'm a 32-year-old heroin addict, and I use she, her pronouns. I live, work, and play as an uninvited guest on the traditional unceded territory and spiritual realm of the Stalo Coast Salish people, or people of the river here in Chilliwack. I have over 15 years of experience living with concurrent mental health and substance use disorders. These webinars are here to encourage connections amongst our incredible network of lived experience experts. I feel honored to be a part of these conversations. Today's webinar is especially cool to me in regards of our webinar theme. The essential practice has an exciting readiness to practice, for this practice to be replicated in other communities. Communities that have an established university or college should now see that they have an obligation and responsibility to do more with their on-hand resources and to get creative and collaborate on harm reduction initiatives with peer support groups in their areas.
Thanks, Tanis. So we will be your hosts for the next 90 minutes or so. To start us off, I would like to point out a few features of GoToWebinar and quickly run through the agenda. So first off, there are two options for sound. You can listen with your computer's audio or dial in by telephone. If you find you're having difficulties with one audio option, you can switch to the other at any point. If you choose the telephone option, either use a landline if you have access to one, or turn off the output noise on your computer speakers to prevent that awful feedback noise. We will be recording today's session and posting the video online on the CMHA YouTube channel. You can also download a copy of the PowerPoint slides from today and resources from our presenters in the handout section of the panel to your right. I'll also post the YouTube link on the chat. And after the presentation from UBCO HaRT and CanDo, we will move into a panel discussion with our presenters. After the panel, audience members will have the opportunity to ask questions. If any questions come up during the webinar, please type them into the questions section on the panel to your right. We will collect them throughout the webinar, and Tanis will read them out to presenters during the Q&A period. If you would like to address your questions to a specific panelist, please make a note of their name or organization in your submission. Before we introduce our presenters, I would like to share a bit about the OD Prep Knowledge Exchange series for those who are joining for the first time. Today's presentation is part of our Overdose Prevention and Response Essential Practices, or OD Prep, Knowledge Exchange series. The project is a partnership between Community Action Initiative, the Public Health Association of BC, and the Canadian Mental Health Association's BC division. The project began in early 2020 and aims to identify unique practices in peer-led groups and community-based organizations to address overdose and poisoning prevention and response. Next, our other goal was to showcase and share these essential practices widely. And lastly, to collect information and these innovative findings to advance policy at a systems level. As a part of this knowledge exchange project, we have also created an online learning community. This is a space to continue our conversation, connect with one another, and share resources to improve overdose and poisoning response and prevention efforts. I will copy the URL into the chat so you can click that if you'd like to join and be a part of our community. At this point, you may be wondering, sorry, next slide, please. At this point, you may be wondering what constitutes an essential practice for overdose prevention and response. We chose the term essential practices rather than the more familiar term best practices because overdose and poisoning response and prevention are not about what we should do, but what we have to do, what is essential to save lives in this public health emergency. Our peer advisory group came up with these 4 key principles to create a vision of what essential practices should look like in order to be inclusive and effective. The first is peer partnerships. The voices and actions of people who use drugs are the driving force of change. The second is grassroots. The practice came from community members taking action. The need, actions, and outcomes were ground up, not top down. The third is local networks. Peer groups, community action teams, organizations, health authorities, municipalities, whoever was involved shared power and worked together as equal partners. And the fourth is adaptability, wanting the practice to be able to be adapted and scaled up or down to meet the diverse needs of different communities. Today's presentation will demonstrate the efficacy of these principles. So now to introduce today's webinar, in 2020, the University of British Columbia's Okanagan Campus harm reduction team, UBCO HaRT, partnered with Interior Health to offer drug checking and harm reduction services on campus and across the Okanagan. In this webinar, presenters from UBCO HaRT and their key community partner, CanDo, will outline how this successful initiative was launched in a collaborative and inclusive way between the university and the wider community. Our presenters will share key insights on how they challenged stigma, shifted misconceptions, and overcame barriers to bring this essential service to the interior region of BC. Now to introduce our presenters. So first, Lauren Erith is a registered nurse specialized in mental health and substance use. For her Master of Science in Nursing, she studied the experiences of rural older adults with mental health concerns using arts-based methods. She is currently a PhD student in nursing at UBCO and is studying the feasibility of the drug checking program you'll hear about today. This work occurs as part of her position as a campus health specialist at UBCO. Next, we have Heather Spence. Heather is one of the co-founders of CanDo. She feels blessed to have an amazing life partner, Joshua. She is also a mother of 5 children and has 3 beautiful grandsons. She originates from the Sandy Bay Nation, a northern First Nations community in Manitoba where she was raised. She identifies as a person with lived and living experience. She moved to the Okanagan in 2018 after tragically losing her younger brother to an overdose. Her role as the Indigenous Peer Coordinator is advocating, supporting, and connecting peers to service providers or allies who struggle with homelessness and/or addiction. CanDo provides various opportunities and empowers peers to be a voice for their community. And next we have Josh Pelletier. He is 32 years old and originally from Calgary, Alberta. He has resided in West Kelowna for over a year now and is currently a peer lead coordinator for CanDo. Josh identifies as a person with a lifetime of lived experience and has had the honor of working with Heather and CanDo for over a year now. He does everything from outreach to hosting peer support meetings and everything in between involved in this line of work. He looks forward to what the future holds for CanDo and peers everywhere. Thank you all so much for being here today. I will now turn the floor over to you if you'd like to turn your cameras and mics on. Thank you.
There we go. Okay, great. Sorry, everyone, just figuring out technical things. I'm not totally used to this platform, so hopefully this all goes smoothly, but thank you for coming to the presentation today. And for those introductions, really appreciate being able to be a part of this webinar series. I think it's a really valuable series, and we're happy to be able to share a bit about our work today. So I also just wanted to acknowledge that from the first time that we met with Rebecca and Tanis in the summer to today's presentation, Adrian Van de Mosler was also a key part of developing this presentation and the meetings, but was unable to be here today. So just want to acknowledge his work in this presentation as well. So we also want to do a land acknowledgement just to talk about how our work and where we live and play is all situated on the unceded territory of the Okanagan Nation. And when we're talking about our harm reduction work and working in drug checking, I think it's important to unpack what it means to have whatever your identity is, if you're able to reflect on that and how it impacts your work, and just discuss the impacts of colonialism specifically on the toxic drug supply crisis. And the stats in BC reflect that First Nations people are 6 times more likely, and First Nations women are 9 times more likely to die of the toxic drug poisoning. So I think it's pretty unignorable, the impacts of colonialism on today's topic. So important to kind of discuss and highlight this as we go along.
Hello guys, it's a pleasure to be here. I'm extremely honored to be sitting beside my partner, and I'm extremely honored to be a part of this amazing group of individuals and organizations. Let's just get right into it. The coordinators for CanDo. I'm Josh, the lead peer coordinator. We also have the Indigenous lead peer coordinator, which is Heather, my partner. We try to share the same role. She has a little bit more weight than me, but don't tell anybody that, please and thank you. Different backgrounds and have a lifetime of living experience. So yes, we are a peer-led drug user support group formed in 2019. And CanDo, not to be confused with VanDo or the old CanDo name, which is Kelowna Area Network of Drug Users. We no longer go by that. We separated ourselves from that because we felt we were stigmatizing ourselves and only inviting an area of drug users to our organization. We decided, well, Heather came up with the beautiful name of Acknowledging All Nations and Developing Unity, which means we're basically everybody and all are developing unity to work on this mission. And CanDo's mission is to improve the lives of people who use drugs or have been affected by drugs, as well as alcohol, homelessness, poverty, and or mental illness. CanDo empowers peers by giving them opportunities to be a voice in the community to make positive change.
In the beginning, like Josh mentioned, we were a drug user support group when we first started, but I realized that there was more than just people that were needing advocacy and connection and activities in our community. So we decided to offer a bit more services than just support and meetings. We did referrals, we did group referrals, we did one-on-one referrals. We help people with get into housing and issues relating to ministry services. We also provide training and mentorship for the peers that we work with, such things as not just naloxone training. Both Josh and I are certified trainers, and our certification is from First Nations Health Authority. We've helped people with trauma training and cultural and capacity building training. We also do outreach in the community, both in Kelowna and West Kelowna. We provide meal supplements in our office space and also during outreach. And being Indigenous, we incorporated some culture and knowledge exchange. We've done teachings such as smudging, medicine picking, arts, music, feasts and gatherings, and teachings such as Star blankets. We did a teaching not too long ago, and we gifted our blankets to the children that were found in Kamloops. Some of our peers created blankets, and we sent them off with a lady to Kamloops.
Awesome, thanks Josh and Heather. So to kind of situate the harm reduction team then as well, and it's a bit of our history and where we come from. HaRT is a part of the University of British Columbia Okanagan Campus, and it is under the leadership of people who are in the Institute for Healthy Living and Chronic Disease Prevention, so Dr. Joan Vitoroff, and then the Student Health Clinic, the director there is Dr. Wilson. So those two folks kind of oversee what's known as the campus health team. We also are involved with the Wellbeing Network on campus, and within that is the Voice Student Research Project. So the harm reduction team was kind of born out of that group of people. And that's also where my job is at UBCO. So as a campus health specialist, that's the team that I work on. And that team also helps to address a number of other health and well-being topics. So things like food security, mental health, physical environment, sexual health, all that kind of stuff. So that's kind of where our work got wrapped into and how it's situated at the university. And for the history of HaRT, there's been a long history of health promotion work at UBCO. And so since the school started, a number of amazing nurses and different healthcare professionals working on campus to introduce a number of efforts around substance use and health promotion things really paved the way for us to be able to do our work. But drug checking specifically initially happened at Frosh 2019, and you'll see here that happened at Frosh 2009, but we didn't have approval for drug checking services until 2020. So it was a bit of an interesting start. And when drug checking first occurred, that was through a student club that helped facilitate that service to happen at the big start of year campus party. And it was from there that leadership on campus was able to see how beneficial that service was. Students were really eager to see more of it on campus. And that's when we really started advocating for more of that initially on campus. So we started advocating following that, which was September 2019. And we had approval kind of around spring 2020. But of course, that was at the same time that COVID hit. And so it was revisited in the fall of 2020, which is when things really got rolling for us, which we'll get more into later in this PowerPoint here. But HaRT's mission regarding substance use is to decrease stigma, improve access to supports, and advocate for person-centered policies by developing resources, delivering harm reduction services, and collaborating with stakeholders. So we do a lot of different promotion, prevention, and support work. I always like to provide a bit of context as well to the discussion. So I think most folks are aware, but it's good to kind of walk through. The opioid epidemic was declared in April 2016 because of the rising number of deaths associated with fentanyl being found in other drugs unexpectedly. And that same year is when the government made naloxone publicly available. So prior to that, it was a prescription drug. Then it became publicly available, which if you're not naloxone trained, you can go to towardsthehart.com, get naloxone trained. And slowly the drug supply has been evolving, which started to happen more quickly with COVID. So we're seeing increasing concentrations of fentanyl, and we're seeing more and more benzodiazepine contamination, amongst other changing profiles of what illicit substances look like. We're also starting to see some strange overdose presentations. So not just what you typically picture of someone, their breathing kind of slowing down, heart rate, that kind of stuff, but we're seeing seizures or strange behavior, that kind of thing, as we see new and evolving drugs impacting our toxic drug supply. And an important note just for language-wise is we've moved from calling it the opioid epidemic to the toxic drug supply epidemic, because it isn't just about opioids, and that's a really important thing to note with our work facility. And when we talk about harm reduction, we're talking about reducing harm when it comes to substance use, but also thinking about reducing the harms of colonialism within that context, because we can't separate substance use out from spiritual, mental, physical, emotional health. All those things work together. So that's how we approach our work. and just kind of getting people on the same page again when it comes to language. Sort of covered harm reduction already. These are just some definitions to help people along. And then peers, when we use the term peers, it's referring to people with lived or living experience of substance use. So again, that's why we're here today, right? That's this whole webinar series, is the importance of peers as the experts in these experiences, and wanting to, I think, do better at including them in our work. And drug checking. We're working our way through all the definitions here. So to explain drug checking, I think it's important to kind of get into that as well. We found that when we talk about drug checking on campus or even in public, the first thing that comes to mind for people is that we're going to be checking them for drugs. But what drug checking actually is when clients bring us their substances and we are able to find out what is in the sample that they provide us. So there's a definition here from the BC Centre for Substance Use that's on their website. And in order to find out what is in a sample that someone brings us, we use what's called an FTIR drug checking machine. So it's in the bottom corner there, you can see, and then immunoassay strips as well, which is kind of the top picture there. That's what those look like, almost like a little pregnancy test, basically. To explain a bit more about how our drug checking machine works, that kind of stuff, we find people like to know that. And again, it provides context to more of the conversation today when we get into how we establish this work. So to receive samples from people, they will collect a sample, which means just something that's like the size of a grain of rice off of the bigger chunk of whatever they're using. And that's folded into a small piece of tin foil, and the foil then goes into a small plastic bag, which goes into an envelope with a completed sample collection form. And the sample collection form gives us information about when did this person buy the substance, did they have any weird reactions to it, is there anything that we need to be aware of specifically with it, and then these samples are brought to us through organizations like CanDo, through different shelters, clinics, a number of different people that are able to facilitate those being brought to us. And once we do get the sample, you can see these are a couple of our student staff here working on the FTIR. So the FTIR machine itself is actually much smaller than what people expect. So you can see it in comparison to our two staff members here. But basically we put the little sample on the lens, which is just under kind of the top part of that machine. And a laser kind of shoots through the sample, it sends a signal to our laptop, and then our technicians will analyze that line and they compare it to the number of chemical libraries that we have in our databases. So then they can go through, break it down, figure out what's most likely in that sample. We kind of call that like the sample's fingerprint. And then once they've determined the best guess of what's in that sample, we dissolve it in some water. And then we use fentanyl and benzodiazepine test strips on that as well, just to confirm any of the analysis we've done, as well as the test strips that we use are more sensitive than the machine. So as far as limitations, the machine that we use can detect anything that's in that sample that's in a concentration of 5 to 10% or greater. So if there's anything less than that, it may not be seen on the FTIR, which is where the test strips are really helpful because they are a much, much more sensitive technology. And can easily tell us just a yes or no if those substances are in there, but it can't give us a percentage like our laptop can. And then we also talk about the chocolate chip cookie effect, which I think many people have heard of. But the chocolate chip cookie effect is the idea that when you break off a piece of a chocolate chip cookie, it might have chocolate chips and it might not. So we like to explain to people that when we get their substance, if they've broken it off of the larger piece, what we see in our results may not reflect the bigger sample or the bigger substance that they're using. So just sort of ideas of how the machine works there. So today we want to walk through exactly how we were able to develop this program and deliver it in our community. So we thought it would make sense to kind of approach it as a recipe, if we can think about that. So the picture on the side of the screen here is one of our technicians currently for the program with a box of donuts that's always given to us by one of our partner organizations, which is super nice of them. So we'll start by looking at what we want to call kind of the key ingredients of this recipe. So Josh and Heather, I think I'll have you on the next slide. So yeah, the importance for us with partners in determining what kind of the key ingredients were, we're finding who's already doing the work or what ingredients do you already have, if we want to stick with that analogy. So basically finding the people who are already doing this work was key for us. We didn't see the point in starting from scratch or trying to do our own thing, make a name for ourselves. We wanted to support the work that was already happening out there and find people who were passionate and knowledgeable about this, which obviously includes people like CanDo, as well as a number of other collaborators that you can see here on the screen. It was also really important early on to bring in decision makers so that we could start talking about what would be necessary for us to have permission and to begin working in the different areas that we wanted to be in. So early on, we identified who are all the different partners and partner groups that we need to bring into this and how do we want to engage them. Something that's kind of unique to our program as well as our relationship with RCMP. So our RCMP locally here in Kelowna have been fantastic in supporting our program and not using it as a way to find out who's using drugs, but instead they actually refer people to our program to get their drugs checked. And if they're involved in an overdose presentation or anything like that, they talk to the client about whether or not that person would like their drugs checked, and they'll bring us drugs on that person's behalf. And all the work we do with RCMP is strictly from a health promotion perspective. So we never work with them in terms of providing information that would be from a punitive perspective where it would be used to charge someone or something like that. It's only ever give the client directly the information from that sample. So that's been a really cool relationship that's sort of evolved out of the work that we're doing. And it was through RCMP samples that we were able to get our team trained on the FTIR early on. Yeah, so here, Josh and Heather, if you want to speak to some of the partners and partnerships that you have.
Yeah, as Lauren was saying, we do work with many different people and organizations, service providers, health institutions. And we had like we said, we kind of started as CanDo, a drug support group. Now we are so much more into the we're to the point now where we're considering changing what we're known as a peer-led support network group, meaning anything from drug checking, support groups, working with people like CMHA, obviously Hope Outreach, Turning Points, Kelowna Friendship Society, LICO, Interfaith Community, Salvation Army. We've been doing working on a curriculum for the bylaw here in the Okanagan and definitely in West Kelowna. We work with UVic, helping them with surveys and also more info and surveying the root of what's going on. Surveys, GSDOA, BC, CDC, MHSA, team, Interior Health, OD Task Force, Peer Advisory, and then the Women's Team PAC, which is new, but I think going to be a really good thing for women involved in this situation that we're constantly battling and dealing with. And Heather is a big part of that. So she can touch on that if she wants to very briefly. Also, UBCO is very huge. Obviously, this being the webinar we're doing together, we're basically partners in that. So, yeah.
Well, thank you guys. Yeah, so CanDo and us, between the two of us, we have a ton of partners, as you can see here. And my hope with this slide was just to highlight basically the number of people that are involved in the work that we do. And for anyone else considering this work, just thinking about who else you might want to connect with at your university or in your community. And I think, yeah, one of the main original partnerships for us was with CanDo, which initially was just starting a conversation around, yeah, who are you guys? Who are we? How can we work together? I think it initially started as finding out that CanDo needed some computers, and we were like, well, I think the IT department has some old computers, and the partnership just kind of went from there. So we didn't start with much of an agenda versus it was more about relationship building and just wanting to come together and talk about how we could support each other's work. So so on the next slide here, kind of along those same lines, talking about how we moved from being partners to creating partnerships. And so the idea of sort of combining those ingredients. So again, Josh and Heather, if you want to speak to sort of what was important for you guys in creating the partnerships that you have and in creating your partnership with us and what that looked like.
Again, CanDo. So you will see at the bottom here the CanDo 24/7 peer support helpline. It's one of many flyers that myself and the team members of CanDo have developed and built. We try to make them as appealing and exciting as possible. As we all know how boring it is opening emails with the same old, just a little bit of typing and just walking by and kind of grabbing your eyes. What they are for, a big thing. I'll just quickly talk about the poster and then I'll talk about the left side of the slide here. Is we are here to help with mental health and substance use. We help people get on the OAT and the IO clinics. We have a very strong relationship working with Dr. Baldwin here in Kelowna and the OAT clinic. Drug checking and analysis, and that's along with the HaRT team and Lauren, that became huge. Housing and sheltering, that was kind of, believe it or not, it's something we don't talk about a whole lot, but relationships and bonds were built in us creating opportunity for people to have housing and sheltering. Food, hygiene, wellness, and wellness checks and outreach. We provide now that we have our spot once again located in West Kelowna, we have a spot where we open up a couple hours a day for people to stop in, to get clean, harm reduction. We have brand new, if not, we have brand new undergarments, brand new socks. We have a lightly worn t-shirts, pants, and we were thinking about getting a winter coat / winter ready drive ready here right away. That's something we want to do. And this poster also was basically saying, call this number you see here if any of these things may apply to you or you may want to know more. And it was a 24/7 phone line, which we honestly thought when we had created it that it was going to be like this, like kids helpline, suicide hotline. Like we'd have 10 guys manning this phone, and we need to have a phone center. And it turned out we're like, okay, we're in Kelowna and West Kelowna. We kind of like took that down, and then we took that number, and then we get, okay, the amount of people that are using drugs and alcohol, and then we put the amount of people that are using drugs and alcohol that might actually need these services. And then we put the amount of people that actually might have cell phones or access to call the phone, and then the amount of people that have a phone that are actually willing to reach out and kind of, humble themselves and ask for help. We realized that that phone did not ring as much as we had liked it to. But that being said, the future holds who knows what, so we're going to keep trying to push it. And if it's available, at least they have a chance. At least there's something. Right. And a big thing that we kept it going was a member of ours, Sarah, God rest her soul. She was my predecessor. We were always at that, and I was always calling Heather, and she was always calling Heather. I love her, and she was an amazing person. She actually did pass on as a result of an overdose. But she said, why don't we have a phone line so that, we can have these opportunities and then people can get a hold of us whenever they need to. And she's actually still the voice you hear on the voicemail. If the phone is not answered that time, you will hear her voice, and we have left it that way because we'd like to keep it that way, because she was such a big impact in the group, and we miss her dearly. And God bless her soul. I'll go to the left side very quickly. Equity, diversity, inclusion, example, people with lived living experience, Indigenous people, where we can do, acknowledging all nations and developing unity between everybody. We want to bring truth and reconciliation. We figured, you know what, finally that the media is telling the truth about what's been really going on with Indigenous people, and how that, you know, these horrific events have happened, and we've known about them for years, and people have known about them for years, but they're really just finally starting to shed light on them. It's sad, but it's about time. So we want that to be a part of CanDo as well, because we know that has a huge result in the effect of addiction and homelessness and Indigenous street entrenchment. Open-minded conversations to explore viewpoints, concerns, benefits. We determine gaps, capacity, provide education, address misinformation, identify necessary resources, make commitments. And at CanDo, we treat everyone like family, and we feel like we've been doing outreach, you know, for a while now, and you will hear, and this is not knocking any other teams, because everybody who's out there helping, they're contributing to a massive, massive problem. But because I feel our group is such a group of individuals who came together as one with lived and living experience, and know what that person that I'm handing that bowl of soup to, or those clean needles to, when I know what they're going through, it creates a closer bond, and they're able to be open with me and tell me what they really need. You know, because sometimes it won't be just that food or that soup. They might need someone to talk to for 20 minutes, and I'll take 20 minutes and I'll get the team to go around and do the other spots, come back, pick me up, or Heather, or whatever the case may be. And we try to treat anybody as family, because we feel like that's the problem, is like you got AA, NA, CA, and those fellowships that are helping each other stay sober, which is amazing. And we want everybody to eventually hopefully recover so we don't have this issue. But there are always going to be people who aren't there. Where do those people go for help? Where's their support? Where's their friendship? Where's their family? Where's their love? Where do they feel they belong? That's what CanDo and with people, and with Urban Matters, and with HaRT being, you know, so welcoming when you drop off your samples. And that's kind of our mission, is to not make it like, oh, I don't want to go there, I feel judged. People want to see CanDo, and CanDo wants to see people.
Yeah, thank you, Josh. I think that was such a good example of these are the kind of conversations we have, right? When we want to move from just recognizing other people doing the work to figuring out how are we doing this work together, and what kind of conversations do we need to have. So it was conversations like this with CanDo that helped inform the manual that we put together as HaRT at the very beginning for how do we want to approach these services, how do we want this work to happen, what should it look like. And CanDo was amazing when we went to them and said, like, hey, how do we build this the right way? And they just immediately stepped up and helped us out, and were there for us in figuring out all those things at the beginning. So this list of things here on this slide just represents what we talk about with CanDo, as well as each of the partners that you saw previous slides here, when it comes to the work that we wanted to develop and how we've informed the work that we've done here. So working through making sure we're doing everything from that equity, diversity, and inclusion lens, and always asking ourselves, how are we incorporating truth and reconciliation into work, and are our partners making that an equal priority? And if not, how can we support them in making sure that becomes one for them? And having open-minded conversations was a really big one for us, because we found there was a lot of misinformation and a lot of difficulty understanding what this work was at the start. So an example I like to use is when we started doing this work in 2019 at the university. There was some misunderstandings about naloxone, and at the time naloxone wasn't allowed into a lot of events because people were concerned about the needles being used as a weapon. So that was a good opportunity for us to sit down and talk through what naloxone is, the pros, the cons, the statistics, why it's an important thing to have at these events. And it's been amazing to see the progress in those conversations with those stakeholders, those groups of people, that we've gone from that to being able to offer drug checking on campus is huge for us. So taking the time to really sit down and have those conversations and not just push an agenda, but really explore like what is everyone's viewpoint, what are their beliefs, where is that coming from, and how can we address it, and where are the gaps that are bigger than us that we need to pull other people into. And then having an idea of who's really committed to the work, who are sort of side players, all those things were critical for us to move forward with what we're doing. And then on the next slide here, this is a slide that I use a lot in the conversations that we have with the different stakeholders that we work with. So this is taken from the BC Coroner's Service report on the drugs that are involved in illicit drug toxicity deaths. So you'll see fentanyl is pretty high up there, but there's enough other drugs that are involved. And this is why drug checking is beneficial, is because we're able to look at when someone thinks they purchased cocaine, but we actually find something like fentanyl in it. That's the equivalent of waking up to have your morning coffee and finding out someone's put Benadryl in it. Not quite the equivalent. One has more serious consequences than the other, but you can understand if you're going to have coffee, you're preparing yourself for something very different than if you're having Benadryl. So when people go to use like a stimulant and there's actually some kind of downer in that, that's more likely to result in an overdose, especially if someone's not used to that type of substance. So this is just a small part of the bigger conversations that we have when we're looking at results. And Josh and Heather, if you want to talk about sort of the wider impact of the toxic drug supply when we're looking at these kind of stats.
Yeah, personally, through lived experience, I've noticed that years and years ago when I started personally using drugs and or alcohol, opiates and heroin were something that were like, oh, that's from the 60s, that's from the 70s, you don't even see that stuff anymore. And then you'd have the old timers kind of talk about their days and like, yeah, that's a real drug and this, that, and the other thing. And, you know, it's weird. And then all of a sudden, you know, marijuana always obviously been growing with popularity. And I feel like with the age, that's marijuana use slowly got lower, which meant the other drugs came quicker, which meant time moved faster, which brings us to today's date, where now in high school you're not getting high off a joint, you're in the bathroom doing lines of cocaine with your friends. That being said, if that's what you're doing at school, what are you doing at house parties, and what are you doing when you've dropped out of school? You've moved on to illicit, more fentanyl, you know, pills, et cetera, and so forth. Top drugs among illicit deaths, drug toxicity deaths, 2018 to 21. This is like, it's scary because, like I said, and when I was in grade 12, I didn't know anybody who even knew where to find or even talk about heroin or opiates. It was, you know, like maybe morphine for or Percocet for a pain pill, but it was so different. And now it's like you have a lot easier time finding a drug like fentanyl, or cocaine or crack or meth than you do weed, or, and believe it or not, at certain times and certain hours, alcohol, you know, and that's crazy to think about. And then you start adding poison to those, and then it's like, pow, we're at a situation of like, you know, it's a scary number.
Yeah, definitely. Thank you, Josh. So those are important things to reflect on when we talk about the importance of drug checking. And something else we also like to talk about in terms of building the partnerships that we have, and just making sure all the voices are heard, is using a trauma-informed practice lens. So for those who aren't familiar with trauma-informed practice, a really good thing to look into and incorporate into the work that you do. But these are kind of the key components of trauma-informed practice. And then we also have the student perspective when it comes to the partnerships that we're building. And unfortunately, like I say, Adrian wasn't able to be here today, but he is a second-year nursing student who is one of the interns and main technicians on our team. So you can see the picture here is where one of the spots where we provide drug checking on campus. And so the students helped kind of inform this part of the presentation as well. And so we work with students as partners, and I think it's important to mention as well, we have a number of different peers who are students who inform our work on campus and talk to us about what's going to work and what's not going to work for students who use substances on campus. So that's incredibly beneficial when it comes to building a program that's going to be effective, because they're already a part of the groups on campus where they can sort of informally advertise the work that we're doing, talk through the different trends, inform us where the students are, what's happening. And then for the students who work with us on the team, they're able to engage in a lot of really unique learning opportunities, skill development kind of thing, especially when it comes to students who are in disciplines like chemistry or studying similar things. They have an opportunity to really apply that to our program here. So when they're in this program, rather than just having like the classroom learning or being in labs, this really puts it into a real world perspective. So that's something we really like to encourage other universities to do, is to think about what skill sets do their students have that can be applied to addressing the toxic drug supply crisis. So we're really lucky to have a ton of students with various skills, from nursing to medicine to social work, students in arts, philosophy, like political studies, all these different pieces. They use those skill sets to things like advocate for policy change, or introduce resource referral pieces, or be able to work on the machine. There's tons of different benefits to it. So this is really a big part of our work, is encouraging other universities to think about what resources do you already have at such a resource-rich institution, and how can those be harnessed to create a program like this. So then the next kind of step in our recipe here is finding the muffin tray, is what we're calling it. So determining the needs, basically, how are you going to create the program? What is it that you need to take that next step forward? So to jump through this, what we decided was we need to take a look at what needs did we have after establishing these partnerships. So we had to make sure that everyone was on the same page. We had to talk about what was our capacity realistically, what did we need to do to raise awareness, find funding, what did we need to train people. So these were all of the things that we needed to figure out in order to move our forward. And once we had figured that piece out, we began to talk about how we could address our needs, who was there, what resources existed for us to address those needs, and how could we integrate those resources into our work. So basically pouring the batter in and getting ready to actually make the program happen. So for those steps, just jump forward here, we wanted to get everyone onto the same page, so that we had shared goals between all of the different partners and partnerships that were involved with this work. And it was really important for us to be transparent about what our limits were, because we had really limited capacity as a very new program. We didn't have other universities to look to that do regular drug checking on campus as well as in community. So one of the ways we did that was by creating an interdisciplinary team. So we have registered nurses in the community, we have community volunteers, and then, like I was saying before, we have students from all sorts of different faculties on campus, because every single faculty has its own skill set to contribute to the work that we do. Within the program, we've also built in ongoing mentorship and recruitment. So making sure that anytime we're running that drug checking machine, that we have somebody who's also training on it. A big reason behind that is because to get someone trained on the drug checking machine properly, they need to do a series of online modules, and then they're required to do 30 hours of one-on-one shadowing on that machine. And then they write a test, and then they're certified to be able to use it. So it is quite involved. And there aren't many people who are trained in this who have the availability to be able to support a program like ours on a regular basis. So that's been a big part of addressing and increasing our capacity. And then something else we found really helpful was creating a website as a landing base for people to go to, get the information they need, rather than us having to field quite as many emails or phone calls or texts, because there are only so many of us and so much time in a day. So we found that was really helpful to be able to point people to for resources, and then webinars like this as well. So when we're talking about creating awareness, in addition to webinars like this, we have newsletters that we submit to. We created business cards, put up posters, work with different healthcare partners. We host different events that coordinate with other sort of timely things happening throughout the year. We've got social media pages, and we do different outreach work things. So this has all been in collaboration with different peer networks on and off campus, but it's all really helped to address these needs specifically. And then when it comes to funding, which we know is always a big part of the work, we are contracted by Interior Health, our local health authority here, to provide these services in the community. Then UBCO provides us with funding through the tuition funds that students pay to go to school. So part of that is allocated for us this year to be able to provide these services on campus specifically, which is amazing to have that kind of institutional support, especially when we talk about, you know, where we started to where we are now. And we also have a number of grants. So these grants help us deliver services at specific places, like our United Way grant allows us to do work out of the foundry. The 2MS grant allowed us to do kind of a bigger project in relation to the drug checking program to raise awareness, get people talking about different things related to substance use. And we also have funding from those grants to just support the staff that are doing the work as well, because we want to prevent people from burning out. That's a really important thing for us. And it's through these different funding organizations. We also have the spaces that we work out of. So we use different mental health and substance use sites where they already do supervised injection, that kind of thing. We work out of nonprofit sites that already do a lot of harm reduction work. And on campus, we work out of an office and residence, and we also work out of the student health clinic. So we're really lucky to have so many options for where we do this work. And then when it comes to the policies and legalities, we have legal exemption under the local medical health officer, and there's a number of other legal exemptions and like bigger things we could get into that are bigger than this presentation when it comes to this. But talking to your local medical health officer is kind of the biggest piece to get that authority, that permission. And then also getting permission from the decision makers on campus, from the board of people at every single location that we work at. So we work out of 7 different locations, which is a lot of people to get permission from when you think about the bigger picture there. And then also making sure we have appropriate insurance was all key to making this move forward. And Josh and Heather, if you want to speak to the fund you guys have for this work and how you were able to get space.
Hi, everybody. I could speak to that. We are currently funded by BC Yukon Drug War Survivors and the Community Action Initiative and the Community Action Team. BC Yukon actually provides financial support for the office space that we secure here in West Kelowna. And the other funding that we receive from CAI is to different programs in the community, and also with the community action team. The funding is specified for wellness.
Thanks, Heather. Sorry, it's a bit tricky hearing you guys, but I think we also have information here coming up on one of our next slides about it as well. So the other needs that we identified earlier there, in order to address our capacity, we also looked at hiring outside of the student population. So there are a ton of benefits to being a part of a university, having students who are already trained in a lot of the skill sets that we were looking for. But we also need people who could maintain consistent hours with our community sites. So that was a really important part of building our program, and establishing drop-off sites as well, where people could just drop off substances at different locations that have that programming kind of set up so that they can accept samples on behalf of people. And then you can see all the training that we've all gone through collectively, basically, to be able to make this work happen. So important for us to have the training behind the technology, but also to have that ally training that's provided through the student recovery community, which is a group of students who focus on what is their relationship with substances, looking at sober living, 12-step stuff, a variety of things. But there's a ton of different training that we go through collectively, basically, to make this work happen. And I would encourage anyone who's considering doing this work to look at this as a minimum of where to start, because we've also done things in addition to this, but this was kind of the baseline for getting it started. And HaRT started specifically, it was because Interior Health approached us and said, we have an FTIR machine to use, and you guys have the skills to use it. So let's pair up and figure out what that looks like. So that's when we began training through the BC Centre for Substance Use, working with Interior Health to develop these things. And then really wrapping in CanDo with the drug checking part of things and figuring out how can we do this, how can we work together. And I know Heather and I had some interesting experiences at the start in figuring out what the heck are we doing with this program and how is it going to work. So that's also been something that's been figured out along the way. And Heather, I'm not sure if you want to speak to any of the training pieces for CanDo before we go to the next slide here.
I can't see what I'm, sorry. Yeah, we were, being a part of BC Yukon has given us different opportunities to participate in different programs like this UBCO drug checking program. And also we were asked to be a part of another program, which is the safe supply, the distribution of safe supply and everything that's involved with safe supply, and that's through music. So we do hear research work through music. CAI came to, CAI is capacity inclusion engagement, which is another thing that's provided by CAI, sorry, and it's to build, they came to Kelowna to do some capacity training for our group. And like I mentioned earlier, we got training for not just naloxone through First Nations Health Authority.
And thank you, Heather. Yeah, it takes a lot of ongoing training to make all this work happen, and working together to collaborate on, what kind of training are we doing? What do we need? Continuing to have those partners to partnership kind of conversations throughout. And then the next step is when we really, once we'd addressed all these needs, we'd integrated resources, it was just time to make it happen, or to bake the muffins, if you will. So a friend in my undergrad introduced me to the quote, "Don't let perfect get in the way of good." I don't have a source for it, sorry, but I think it's a really good thing to keep in mind in launching programs like this, because they are so novel. Making sure that you're doing things safely, informed, and evidence-based, and with the expertise of peers, I think is critical. And then you just learn from there. So we launched in December 2020 in Okanagan Campus, and as you can see, we really quickly expanded. So we've had to navigate a number of different challenges along the way, and we continue to have a lot of support and education through the BC Centre for Substance Use and Interior Health Harm Reduction coordinators to make all of this work happen. But when we started doing it, it was just kind of a matter of saying, like, okay, we're doing it once we had the permissions, and then just learning from there. So also wanting to encourage people that you don't need to have a perfect program to launch it. It's something that is built on along the way, right? And we're happy to talk to people more about those program pieces too. So, and this picture here is from a drug checking session that we did in Penticton at one of their mental health and substance use centers there. So you can kind of see what happens in action. It's not anything super exciting, but there's the laptop. You can kind of see the line there, our FTIR, all that stuff. So. And then once we really started to have some data from the program, see how it was working, we were able to see what the results of our work and how it was impacting the community. So this is how we share results with folks after we get the analysis. So this is just to give an idea of what information we share, what's included in that. And on the side here, it shows one of our social media posts, because we also post results to our Instagram page, a number of different places. So once we got the program up and going, once we just made it happen, it was important to us to share with the community what was happening and be able to provide informed sources to the people who were using our services. And this is, again, something where we worked with Josh and Heather to say, like, hey, is this the information that people need? Should we be talking about something else when we're telling them what the analysis is showing? So it's been really helpful having like this partnership and informing how we're doing this work again. And when we're working in the community at different awareness events to talk about why we share what we share. And this is just a quick overview of the different kind of substances that clients have been bringing in since we started and just how that's varied. So another thing I like to point out with this as well is just looking at the impacts of CanDo did an amazing job of supporting people getting their samples to us and getting the analysis. So we could get this many samples in. They did an amazing job with that, but it also shows how difficult it is to maintain that level of work with us. So it's important to support peer groups in finding even more resources. So these are just some of the other outcomes that we've seen and had clients talk to us about through our work. And just trying to speed through the last few slides here, we can kind of have more time for audience questions. So you can see those on the slide. And then it's important as well when we're doing this work to talk about all the different pieces that we include. So it's not just about drug checking. We do a million different things around the drug checking to make sure that people are comfortable with our services, that they're informed with what we do and why we do it. And so we're at events like International Overdose Awareness Day, and we host different workshops and meet with different stakeholders, all that kind of stuff. CanDo talked about the amount of outreach work that they do earlier on. I think that's a huge, huge part of all of this working together. And an example of some of the outreach work too is this bottle on the side. One of the students working for the harm reduction program helped design that bottle. We filled it up with harm reduction supplies, distributed it throughout the community. So I like to try and come up with creative ways to engage people with our work. And that was through the 2MS student initiative funding that we were able to do that. And then we found it was important to really continue to alter the work that we're doing. So continuing to find ways to decrease stigma, advocate for safe supply. CanDo is working to become a nonprofit and needs funding to support those efforts. And we're always working to enhance access to different pieces of the system, changing the system, incorporating those cultural teachings, and planning ahead for us as well. We're looking at different research projects that we're currently a part of and will be a part of. We'll be establishing an anonymous safety deposit box that people can use to drop samples off in, because that anonymity and stigma piece is really big. We're also introducing the student recovery community at UBCO right now. We want to enhance our in-person checking and introduce a number of other initiatives. So lots kind of in the works here. And we continue to face different challenges with our work. So you can see here, there's ongoing things that we're facing and working with all of our different partnerships and funding organizations to figure out how can we make this work happen. So if you want to get a hold of any of us, the contact information is here. I know the slides are in that as well as a resource type thing for folks to look at. And this is also where you can find any of the info for the harm reduction team on social media and some additional resources. So I'll stop sharing the slides here and just pop it over to Josh and Heather if you have any final words before we jump to some questions.
Hi guys, Josh here from CanDo. I just want to say that I feel this webinar has been nothing but one of the best webinars ever, because all of us were included. Just kidding. You know, very, very important. I think that when you put the amount of work that all of us have put into it, day in, day and night, like day in and night, and actually spent our, you know, our hard-earned money on gas and kilometers, getting to each other, getting these, you know, get this outreach done and getting these samples to you guys. I feel like, you know, with webinars like this, at the end of the day, it somewhat makes it a little bit more worth it. And it says, you know what, at least we're doing this and we're creating something that in the future, we can do this again in 2 years, in a year, in 6 months, and we'll say, this has changed, this has changed, this has changed. And it's like basically a broad spectrum of the problem that we're facing at this exact moment in time. And I want to thank you guys for inviting us, because CanDo is our life. We call it our first baby. We're working on our second baby right now. CanDo is our first baby, and we are going to make sure that it maintains its fullness. Is always available whenever you guys need us. Just reach out.
Thank you, Josh. Rebecca and Tanis will throw over to you.
That was a great presentation, everyone. Okay, So we've got some comments and questions from the audience that we can start off with, guys. These are comments for Heather and Josh. We've got some expressions of awe and gratitude for your empathy in this work. And sorry to hear about the loss of your brother, Heather, and so many of your friends. Another question from the audience here is that drug checking is a great idea. However, I do not see how it could work when a person is buying a small amount and from different dealers. It seems that it would only work, in my thinking, if someone was buying a large amount from one person. Can you talk about the difference between drug checking in small and large amounts? I know that Heather and Josh, you guys are active in bringing samples. Maybe you can talk about the sort of the turnaround time from when someone does drop off a small sample.
I don't care who you are, I don't care where you're from, I don't care what. If you are in a situation where you are going through opiate withdrawal and you have purchased opiates and you are not 100% sure what's in them, unfortunately, that's a risk that everybody is willing to take in order to get the feeling of sickness and death out of the way. Okay, and that's what's causing our problem. I think our biggest motive is to get FTIR machines mobile, get them in places where we can have them in, around tent cities, around where drug trafficking is frequent, but also under the radar, so it doesn't look like we're trying to infiltrate some sort of law enforcement bullshit. That being said, it is very difficult because if I buy something and I need to use it because I'm sick, but I want to make sure that it's safe, and you're not here until Wednesday and it's Monday, there's no way in hell by Wednesday I hopefully would be on Suboxone. Realistically speaking, never happens, right? So I think the biggest thing is to push FTIR machines, outreach teams, getting samples, looking to see what kind of samples are similar, who has, a certain type of fentanyl. It's like, okay, it seems to be like a blue fentanyl that's going around, and multiple people have it. It seems everywhere. Boom, let's get that sample. We're pretty sure that most of the blue stuff that's being distributed is going to be from the stores. The only thing with danger comes with that is that if that stuff is poisonous, you have now put ourselves at risk by telling everybody do not purchase that product because that product is poisonous, right? So it is an issue, it's a boundary that now we feel like
Sorry, Josh, we can't hear you. Could you go a little closer?
I feel like if we did have a couple spots where mobile FTIR machines were available, they set up in the morning, they set up for a couple of hours where they were collecting the samples, okay, and or doing the samples at the same time as they usually do, then at least at the bare minimum, in a couple hours from now, and we've talked about this as well, like that big hotel sign downtown in Kelowna where it just says hotel. Why is there not like a little board on there that says, this fentanyl was purchased and has been tested and is 100% poisoned with benzos. Do not use, right? And this particular substance was purchased as crack cocaine, and 2 people have now been hospitalized as a result of overdose. Okay, I think we need to have multiple FTIR machines. I know they're expensive, and we need to have a spot where people frequent enough or is high enough in the air so that it's a sign that they can read it and say, okay, the stuff that's bad, it's saying it right there on the screen. So let's avoid that stuff at all costs. okay? And that's very, very tough, but that's one of the only ways I think you're going to be able to do it, so it becomes quick enough, like honestly.
Yeah, I
Because
think,
in Vancouver, I did a show and we went to the Doll Festival, and I had two products that I had brought from Kelowna to have tested, and within 15 to 20 minutes, they did have an answer for me what the ingredients of my product. So we know that it is possible. We know that it's annoying and but if we're really want to like use this and like make this something to make people safe, that's what has to be done, and that's how we feel I can do as it, like that's our opinion.
Yeah, I hear you, Josh. So what you're saying is we need more resources so that these FTIR machines can be mobile, and we need this to be 24/7, as well as when you get a sample that is toxic, we need to be able to spread that information, what it contains, what it looks like, and where it's being found. Okay, this next message is
Exactly, and then sorry to interrupt you, but just like we've talked about this with Lauren many times, was like finding out where can we get a sign that's one of those digital signs. Tends to be crazy expensive, but just something that's big enough and that's in a populated area where it's frequented by drug users. That you know what, like this particular substance was found multiple times now and has landed people in hospital. Like where can we do that? How can we set that up?
yeah, those
And we're
toxic
still
drug alerts.
figuring that out.
Those toxic drug alerts are so important, and we do need to find like a provincial or even Canada-wide way of promoting those alerts when they come out. I know that the downtown east side has a pretty good system for that, but it's such a widespread problem. I'm going to shift the question now to Lauren. There has been critique regarding the inclusion of police in harm reduction services, given the incompatibility of drug enforcement with grassroots harm reduction. I'm curious if you can elaborate more on how you ensure that police aren't using soft surveillance tactics and how you ensure equitable access for folks vulnerable to criminalization.
yeah, that's a great question. It's definitely a controversial piece for us, that partnership with RCMP, and we found that it's really beneficial in terms of our partnership with them has come from a place of protecting the rights of people who are using the program and accessing the program, and ensuring that it's not an opportunity to further enforce that the criminalization narrative, basically, but it's coming from a place of supporting public health and move towards advocating for safe supply. So the way that the RCMP see it is that they're often on the front line when they're attending an overdose or that type of thing, and they wanted to start doing that from a perspective of how do we support these people and how do we criminalize these people. So we've had some really fantastic, really educational conversations with the RCMP around that, and it's really opened the way for I think improved relationships in our community between RCMP, people who use substances, and the different harm reduction programs that exist. We've had to navigate it very carefully, but the way that we're able to do this in a way that focuses again on the health of the person who's using the program versus criminalization or punitive measures is when the RCMP, if they ever bring us a substance, the process that has to be followed is the person who provided that substance to the RCMP gave permission for it to be given to us for checking. And then the information we provide as far as analysis is either directly to the client and is not provided to the RCMP, or is through the nurse who works in conjunction with the RCMP. So our local RCMP team here has nurses as part of their team. Those nurses are hired by the health authority, so we work within the same group essentially. Like we're interior health employees for all intents and purposes. So it would be similar to me sharing with another nurse colleague at the hospital, like, here are the results for this patient. Can you pass that along? So nurses working with nurses from a public health and health promotion perspective, whereas it doesn't get shared with our CMP records. So it's very separate. We've come up with clear language, understanding, policies, procedures around it to make sure that there is protection of the person. And that's, yeah, a pretty clear division, I think. I hope that answers the question.
Yeah, that's great, Lauren. Thank you. So this next question, probably for Josh and Heather, how do you engage with, or do you plan to engage with people who manufacture or sell drugs in the area? Are people who sell drugs interested in being able to check them before they sell them so that they are safer for people?
Hi, Heather here. With regards to that question, I guess it depends who you know on the street level and what area they're in. To be honest with you, the people that are selling the drugs, it doesn't matter to them. Like it's financial income for them, right? So whether they're selling drugs that they make or drugs that are poison, they still sell it.
Yeah, that's an unfortunate reality for sure, Heather. Thank you. Maybe Heather, you can also elaborate on this question for us since we haven't heard from you much. Do you want to talk about like the demographics of people that you help at CanDo, ages and other communities they might come from, LGBTQ and Indigenous people?
Yeah, I can answer that. We've really changed over just from trial and error helping people, because there are peers that are in recovery or that are wanting to get better, that have families, that have children, that are elderly, that are Indigenous, that are non-Indigenous, that we work with. So we work with a variety of ages. So I think the youngest person that we've helped on the street was 14 years old. But I mean, with people that come to our support meetings or that learn about us, that have children, they want to include their children so that their children can understand the dangers of using drugs in the community now, as opposed to when Josh was mentioning earlier how, you know, things have really changed from when he was younger. And so with answering that, we work with a multitude of people, different ages, different backgrounds. For myself, being Indigenous, I just find it's easier for us to connect with the Indigenous population on the street because they can relate and they trust, right? That's one of the biggest things when we're out doing outreach is that trust relationship. We've built that over the last couple of years doing outreach. And so, again, we work with people different ages and different backgrounds. It's not, our program or our group is not specified for a certain age or a certain authenticity. Sorry.
Yeah, that's awesome, Heather. Thank you so much for that answer. And I totally agree. I think Josh and I are around the same age, and how he described being in high school and really poisonous opioids just weren't around. They weren't easy to find. There might be oxys around. And then everybody knows that stereotypical story of what happened with Oxycontin and then how fentanyl came out with the change in the prescriptions. So yeah, it's such a different market out there. And I've also worked with youth, so working with a 14-year-old on the street is a tricky situation, and I commend that work for sure. Okay, so we're just going to wrap it. Do Heather, Lauren, or Josh have any final comments for the audience?
I think it was just awesome to be here and have a chance to talk about some of this partnership work and to hear more from Josh and Heather, who are doing really important work in the community. And I think if anyone has more questions about the development of the program or any of those pieces, they can contact us at our contact info is on the last slides there. That again is in the handout thing on the side panel here. So thank you again for organizing this with us, Tanis and Rebecca.
Thank you again to all of our presenters, as well as to everybody who joined the webinar today. Before we all sign off, I just want to remind you to join our OD Prep Learning community to stay connected and continue the conversation. The URL is up on the slide, but I also added it into the chat. Thanks again, everyone, for joining. And if you'd like to have access to the recording of this webinar or any of our previous webinars, visit the CMHA BC YouTube channel. Have a lovely rest of your day.